Dr. Ovadia, welcome back, my friend. You know, there's still questions I get on social media about cholesterol. We have more and more people doing keto, carnivore, and for a majority of them, their cholesterol is going up. Something I learned from you is that there's only really one cause of heart disease. I'd love for you to explain what that one cause is, and then maybe the main contributing factors to that cause.
Yeah, unfortunately, Ben, cholesterol is the issue that just won't die. And been talking about it for years now, almost to the point that I'm sick of talking about it, but it is. It's the same question I get all the time, and it's the number one question that comes up. And we got to change that narrative. And we got to change the narrative to heart disease is about insulin resistance. Flat out, that is the cause, that is the root cause, the primary driver of insulin resistance, of heart disease is insulin resistance. Once you have the insulin resistance, once you have the damage to your blood vessels, that's where cholesterol comes into the story. But focusing on cholesterol has not gotten us to where we need to be. I am preparing, I'm going to be talking this weekend up at the Low Carb Boca conference. When we're recording this, by the time it comes out, that will already be gone. But, one of the things I was looking at was just this whole history around cholesterol, this whole narrative, and how it is a failed war on heart disease. Most of us understand the story, right? Eisenhower has his heart attack, 1955. And we think about that's when the war kind of started. But it turned out that Truman was actually the president that declared war on heart disease. 1941 is when we really started this battle against heart disease in this country. And so here we are now, we're coming up on, we're past 80 years,
Wow.
It's going to be 100 years soon that have been dealing with this, and we've essentially made zero progress. And that's because we've been focused on the wrong thing the entire time.
Yeah, the same conversation could be had about cancer, right? This war against cancer. There's a gentleman, Ancel Keys, who played a big role here, who did this 22-country study to prove that his hypothesis was correct. The countries that had the highest rates of heart disease also consumed the highest amounts of cholesterol and saturated fat. And of course, that 22-country study turned into a 7-country study. And out of those 7 countries, what did he find? You tell me.
Yeah, well, he handpicked the 7 countries that seemed to support that narrative. And you go back to his paper and you look at that graph, and it showed a nice straight line relationship between the amount of saturated fat in the diet and the incidence of heart disease. But when you go to the real data, all 22 countries, you see that there's no relationship. And you certainly see countries like France at the time had the highest consumption of saturated fat and the lowest incidence of heart disease. Like I said earlier, the cholesterol hypothesis, this diet heart hypothesis that started with Ancel Keys, it needs to die because it was never true in the first place. And here we are, 70 years later, still trying to undo the damage that was done by pushing that false narrative.
What is the cholesterol doing when there's damage to the arteries, which you mentioned, that is the only cause of heart disease, damage to your blood vessels? Why is the cholesterol increasing in that area?
Yeah, the cholesterol is there to fix the damage. It's our body's repair mechanism. Now, there are 2 issues that come up that end up leading to heart disease. Number one is when you keep doing damage to the blood vessels from things like high blood sugar, it can be from smoking, it can be from high blood pressure, stress. All these things can lead to damage to the blood vessel. And if you keep doing that on a repeated basis, and the cholesterol has to keep repairing the damage, that can be one problem. But the real problem is when the cholesterol itself gets damaged. The cholesterol itself becomes dysfunctional. And instead of doing a nice repair on the wall and then kind of going away, getting reabsorbed, which is what's supposed to happen, this dysfunctional and damaged cholesterol itself causes an inflammatory response. inflammatory reaction, and it gets trapped within that vessel wall. And now you start to build up all of this inflammatory material, and that's what leads to the plaques that we see. So it's not that cholesterol is bad, it's that damaged cholesterol particles are problematic. And that brings us, again, back a step to say what causes the cholesterol particles to become damaged in the first place, and it leads us right back to insulin resistance.
It's really interesting. You know, insulin, I believe, is that first domino, as you mentioned, to fall. That leads to, of course, prediabetes, diabetes, heart disease, cancer. And the thing about insulin, it's so interesting because we could be insulin resistant for, studies are showing 6 to 14 years, depending on the study you're looking at, with your blood sugars not changing at all, whether it's an A1C or a fasting blood sugar. Yet, most people are not getting a fasting insulin blood test done. Can you share why that's very valuable to get done?
Yeah, I agree. I think it's probably the most valuable test that people can get. If there's one test that I tell people, ask your doctor for, insist that they do it, it is that fasting insulin level. And if your doctor won't do it, go get it done yourself. It's really not an expensive test. And you can get that done. And like you said, it's going to show you a decade, maybe even longer, before you get to the point that your blood sugar is now out of control. Your insulin level will be raised, and that's the red flag. And if we pick that up, we can stop a lot of this damage to the blood vessels, where I'm most concerned, but also to the brain and to the other organs, before it happens. The problem is, by the time you have that elevated blood sugar, by the time you have diabetes, you've probably already done significant damage to your blood vessels. And, you know, we pick up heart disease too late because we pick up insulin resistance too late.
That is such an important test. And it goes a step further, right? When we get the test done, we see the standard reference range, which is like 3 to 25. And if you're 15, 17, 21 on that fasting insulin, you might think you're okay because you're within that range, but you want to be in a much narrow functional range. I'd love for you to share more there.
Yeah, definitely. I agree with, you know, a lot of other practitioners who say it really should be under 10, probably under 8 is ideal.
Yeah.
But at least, you know, keep it in the single digits. Anything above 10 is that warning sign that you are on your way to insulin resistance or already have insulin resistance. And, you know, the insulin test in and of itself isn't enough, but at least it's that starting point. It gets, you know, you and hopefully your doctor thinking about, all right, we might have a problem here. And then we can do some of the, you know, more in-depth testing to really understand how significant your insulin resistance might be and to start to think about what to do about it. Because this is the other powerful thing about insulin, is it really directs you right towards what to do about it. Blood sugar, which is kind of most doctors' metric, doesn't really tell you what to do about it, right? It pushes you towards medications and things like that. Whereas insulin, if the problem is, okay, insulin is too high, then you ask yourself, well, how do I get my insulin lower? And that answer becomes pretty obvious. You stop eating the primary thing that stimulates your body to make insulin, carbohydrates. And your insulin will come down and you can reverse your insulin resistance as long as it's picked up early enough.
And it could happen fairly quickly, weeks to months in a matter of, in some cases. You know, the piece with the high blood pressure, tens of millions of people, I don't know the stats, maybe over 100 million people might have high blood pressure. I got to check the studies, my stats on that. But with high blood pressure, there's been so much focus on salt and sodium. And we know that a lot of the studies are flawed. It's based off of like flawed research. And when you have elevated blood sugar levels and elevated insulin levels, we know what happens there. Well, it strips nitric oxide from the body. When we strip nitric oxide, which helps vasodilate, open up the blood vessels, when we strip it, what happens? We vasoconstrict. We make the heart have to work harder, which raises our blood pressure. So are you in that camp that this is what's happening with high blood pressure, or do you think there is a role with sodium and salt?
Yeah, so high blood pressure, again, clearly a insulin resistance related disease. It's actually one of the markers of insulin resistance, of metabolic health, is your blood pressure. Unfortunately, it doesn't get recognized as such. And all the mechanisms you mentioned, nitric oxide, the blood vessels get stiffer and, can be mechanically damaged by this high blood pressure. So that's why we see high blood pressure being so closely associated with heart disease, because it's the same root cause. It's just another manifestation of that insulin resistance. And salt, again, similar to cholesterol, right? The reason that salt got blamed for high blood pressure is because the majority of the salt that's consumed here in the United States, and probably worldwide at this point, is in processed food. Mm-hmm. And really, salt intake became a marker, a surrogate for processed food intake, and that's why it's associated with it. Interestingly, if someone comes into the hospital, into the emergency room with super high blood pressure, and we're worried that they're going to have a stroke, one of the treatments to bring the blood pressure down quickly is to give salt. We give what's called hypertonic saline, which is a saline solution, an IV solution that has a high concentration of salt compared to our normal blood concentration of salt, and that actually brings the blood pressure down. And
wow.
That should alert people, right? That maybe salt isn't the problem if you can fix high blood pressure by giving salt.
Interesting. That is so fascinating. What is more important to look at? A1C, which we know is the 3-month average of your blood sugar. Are you more concerned with I know your answer, but I'm going to ask you anyways. Are you more concerned with a high A1C as it pertains to heart disease or high total cholesterol?
In the end, right, the A1C is more important. Now, it's contextual, right? Because if your A1C is high, your high cholesterol is going to be a problem. If not only your A1C is okay, but if you're not insulin resistant, that high cholesterol is likely not a problem. And that's the nuance, that's the context that oftentimes gets lost, right? When people are trying to, straw man, the argument, right? The way that I talk about cholesterol, they'll say, oh, well, you're saying cholesterol is meaningless. And, but we know that high cholesterol is associated with heart disease. So how can that be? And the real, message that I'm trying to get across to people is if you don't have insulin resistance and you don't have inflammation, you don't have to worry about high cholesterol. But if you do have insulin resistance and you do have inflammation, high cholesterol is certainly problematic. And the problem is if you only treat the cholesterol part of it and you don't address the insulin resistance and the inflammation, you're still going to end up in trouble. Because even having low cholesterol can be problematic if you have insulin resistance and inflammation, because most of that cholesterol that you have is going to be that dysfunctional, damaged cholesterol that we're worried about, and it still can cause the damage. And that's honestly why I think I, as a heart surgeon, see so many people that have been on cholesterol-lowering medications for decades, and yet they still end up on my operating table because we missed the root cause. We didn't address the true problem. The inflammation, the insulin resistance has gone on unchecked for all those years. And even though your cholesterol is low, that cholesterol is still causing problems, still building up in those plaques.
You mentioned you're a heart surgeon and you have your book, which if you're watching on YouTube, we have it right here, Stay Off My Operating Table. Such a great title. That's also the name of your podcast. How many surgeries have you performed to this date? Do you have any idea?
Yeah, it's well over 3,000 at this point. 25 years as a heart surgeon now. Seen a lot of damaged hearts.
Yeah, different ages, different groups, different ethnicities, and wow, over 3,000. Okay, and you actually follow a carnivore diet and recommend eating a carnivore diet, and you're a heart surgeon. Why do you love, and I love carnivore too, but why do you love it?
Yeah, I love it because it is one of the, I find, best ways, most effective ways to reverse and avoid insulin resistance. And like I said, that's what it's all about. That's what heart disease is all about. That's what chronic disease in general is all about. And so I think carnivore is one of the best ways to address that. I don't think it's the only way, and I don't tell everyone they should be carnivore, they need to be carnivore, but I want people to understand it's an option. And for me, quite frankly, I've found it to be the easiest option. It's just simple. The concept is simple. You don't have to count things. You don't really have to worry about, is this on the approved list or is this not on the approved list? It's kind of just like eat meat and animal products and move on with your life.
I'm with you on the carnivore part. I mean, it's such a powerful tool, such an anti-inflammatory diet. The opposite of what we have been taught, right? Red meat causes heart disease. No, that's not necessarily true. I had Dr. Sean Baker on yesterday, who we know is a big proponent of the carnivore diet. He taught me something I didn't really know, and I want to know if you've seen the same thing. He had mentioned to me that his HDL, his high-density lipoproteins, are not as high as the average person, and he's seen those who have a lot of muscle mass have not low, but lower HDL levels. And I didn't realize that your muscle cells actually use some of the HDL, and those who are typically have a lot of muscle mass might have less HDL levels. Have you seen that as well?
I have noticed that HDL is widely variable in the ranges that people have. And, I've always said, a fair amount of that is probably genetics. What I consistently notice when people go on low-carb carnivore diets and they improve their insulin resistance, we know the HDL goes up. But, having the HDL of 80 or 90 versus having an HDL of 50 to 60, first of all, there's really nothing that tells us that your outcomes are going to be different there. I think, if you're in a decent range, which I consider to be above 50 generally for your HDL, you're probably all right. And then why some people end up with the HDL of 110 and some people, it hangs in the 50s, bit of an unknown. My HDL runs, generally in the 50s to low 60s. I unfortunately am nowhere near as muscular as Sean.
Not a lot of people are.
Can't eat as much steak as he does, but I haven't dug into that about the muscle using it, but it's an interesting hypothesis.
Yeah, he said there's some papers on it.
Something else to look at.
Yeah, so I have it in my notes to look it up. I just haven't had time yet. He says there's some papers on it. With the HDL part, you mentioned some people could be at 110. I've seen that as well, 115. Is that an issue when it's too high? We know that it's the body's janitorial system. Is it a problem when it's really high? Is it doing it for some unknown reason or a specific reason that we should be aware of?
Yeah, so there have been a couple of concerns around high HDL, exceedingly high HDLs. Some people have theorized that it might reflect that your HDL is inefficient, right? And so you need more of it to be doing this recycling. Like you said, HDL is really the cleanup. It brings the cholesterol back to the liver to be reprocessed. And some people have said if your HDL is very high, it may be that your HDL is not functioning well, and you need more of it to, kind of keep up with that task. I don't think we've really, figured that out quite yet. Another kind of issue around HDL is that raising the HDL, at least with medications, hasn't been shown to be beneficial. There was a flurry of development, probably this is late 90s, early 2000s. There were a number of pharmaceuticals developed that raised HDL cholesterol, but the problem is they didn't improve heart disease outcomes. So that has led to a kind of narrative around HDL being not important. And I don't think that's the right way to look at it. I think, like a lot of things, causing effects by pharmaceuticals is not necessarily the same thing as causing effects with changes in diet and lifestyle. And when the rise in HDL that we see is really reflective of underlying metabolic health improvement, it definitely improves outcomes. But trying to do that sort of, falsely with pharmaceuticals may not have the same effect because, HDL cholesterol and triglycerides are our two cholesterol-related markers of metabolic health. And again, when we see people, successfully implementing low-carb carnivore diets, those two things usually move together. The HDL goes down, the HDL goes up, and the triglycerides go down. If you're just raising your HDL, but you're not bringing your triglycerides down. I think that explains why we don't see, those same outcomes.
One of the best predictors that will determine how long you live is VO2 max. VO2 max is the maximum amount of oxygen your body can use during intense exercise, indicating your aerobic and cardiovascular health. What if there was a way to improve your VO2 max, which may extend your lifespan at the same time, help you build muscle and burn fat in a fraction of the time that it would take to go to the gym? Well, I'm referring to the Kārol bike. And I gotta tell you, I've been using my Kārol bike for weeks and I absolutely love this machine. The Kārol bike was developed with leading exercise researchers to deliver the shortest, most effective workouts. Their signature re-hit workouts create the most potent training stimulus in just two 20-second sprints. It's scientifically proven to deliver superior health and fitness benefits compared to regular cardio exercise in 90% less time. Unfortunately, 95% of Americans don't exercise, and their number one reason is they don't have time. Well, the cool thing with the Kārol bike is that the workouts are only 5 to 8 minutes long, and you just do 2 to 3 workouts per week, and you'll get all of these amazing results. As a subscriber to my YouTube channel, Kārol Bike is offering you $250 off your bike. Head over to carolbike.com/freedom and use the coupon code FREEDOM for $250 off. We'll also drop that information in the notes down below.
Have they created a medication to lower triglycerides?
So there are a few options there. The most widely used one is basically the prescription grade fish oil products. Vascepa is the name of the one that's most commonly used. And in my experience, that can have modest effects. Okay. I really haven't been impressed by it. We see much more dramatic effects when people go on low carbohydrate diets than you get with those medications. So that's probably the most common one. Now, GLP-1 inhibitors, which of course are the hot topic of the day and everyone's focused on their weight loss effects, they do actually have some metabolic effects, and they have, bring the triglycerides down some. And there also does seem to be some HDL raising that occurs with them. Again, way more modest than we see in people that do low-carb diets, and I think the trade-off, the side effects, probably not worth it. But it's interesting to see that, GLP-1, in a lot of ways, right, is the mediator for the effects we see from, low-carb diets improving metabolic health. And yes, you can sort of mimic it with the pharmaceutical, but I don't think it's nearly as good of an approach.
It's not, it's going to be difficult to create a pharmaceutical that's going to be more powerful than the inner physician we have within us, right?
That's exactly it.
Carnivore, keto, sprinting. I know our good friend Dr. Sean Omar would say, like, you reduce your visceral fat, you'll start to optimize those numbers. HDL will go up, triglycerides will go down, and you could do that with lifestyle changes, which is great. I mean, you don't have to spend money on it. It's free. You could go out there and sprint. You could get some sunshine, get nitric oxide going, eat some red meat, eat some eggs. Like, these are things that have been around forever, and they normalize your levels. You reviewed my labs. Remember, we did that video. And many of you watching or listening may have seen or listened to that 90-day carnivore experiment. My total cholesterol went to 450 after day 90 of carnivore. My total LDL went to 350, right? If we just looked at those two metrics, and I showed that to cardiologists that are not like you, they would think I have a problem. They would think you need to be on a statin. However, my insulin was 3.2, my A1C was 5.1, my C-reactive protein was 0.5, right? A1C was terrific. So it's a full picture we want to look at here. And with the triglyceride to HDL, do you like looking at that ratio, and do you like to see a 1-to-1 as an optimal ratio of triglycerides to HDL?
Yeah, I think anything under 1.5, again, when you divide your triglycerides by the HDL is a good target. If you get it to 1 or even under 1, even better. Yeah. But I generally say 1.5. Now, I don't like to rely on that completely. It's a pretty good surrogate for insulin resistance, but it's not as good as doing the direct measures of insulin resistance. And there are some situations where it doesn't seem to hold up. And one of the things I'll comment on is if you are on statins, if you are on cholesterol-lowering medications, that can actually falsely throw that ratio off. And I'll see people that are insulin resistant, and yet their triglycerides are kind of being suppressed some by the statin, even though the statin isn't really supposed to lower triglycerides, but there seems to be some effect there. And that ratio may not be a true reflection of whether or not you're insulin resistant. But if it's all you have and all you have is your cholesterol panel, it's an okay way to start. I think on the other side, right, when it's abnormal, it's definitely an indicator of insulin resistance. So if it's above 1.5, that should be another prompt for you to look into the insulin resistance issue more.
Have you had people that you've operated on heart surgery who have been on statins and still they end up in your table?
All the time. I would say actually the majority of patients that I operate on are on statins, and
wow.
A lot of them have been on them for long periods of time. And it's interesting when you bring that up, with the cardiology community, and they say, well, that's because we didn't start them soon enough, and we didn't get the cholesterol low enough, and now we have more powerful medications like PCSK9 inhibitors to bring the cholesterol down even more. And I just think they're kind of, it's just, you could call it brainwashing, you could call it just putting your head in the sand. They just don't want to look at the fact that this is a failed paradigm, because honestly, it's the only paradigm they have. Mm-hmm. When you talk to the average cardiologist, the only tool they have against heart disease is managing cholesterol. And ultimately, I hope to empower more cardiologists to understand that there is something you can do beyond cholesterol. There is something that you need to do beyond cholesterol, and figure out if your patient is insulin resistant and attack that problem. And it has much more powerful effects, dramatic effects against heart disease than just managing the cholesterol.
Is there ever a time and place where you would recommend a statin?
Yeah, I have people that are insulin resistant and they have inflammation and they have high cholesterol, and they're not willing or able to do what it takes to reverse the insulin resistance and the inflammation, then there is a benefit to taking a statin in that situation. There's a trade-off. There are negative effects from them, but you're probably better off with the statin than without the statin in that situation. I'd much rather you address the insulin resistance and you address the inflammation, and then you might not need the statin. But if you're not going to, then take the statin.
What considerations should there be for taking a statin? Should there be any other supplementation that could help?
I think that if you're going to take a statin, you should be supplementing coenzyme Q10. We know mechanistically statins deplete coenzyme Q10, and coenzyme Q10 is important to heart health. It's controversial in the cardiology world. It's interesting when you look at the literature around CoQ10 supplementation with statins. Generally, there has not been a benefit. I think those studies were done in ways that, they were designed not to show a benefit. But I do have a number of, people that I've worked with that want to keep taking the statin. They've maybe had some of the effects we worry about, things like muscle problems. And coenzyme Q10 seems to help mitigate some of the damage that gets done by statins. There's also the other thing I bring up around cholesterol lowering these days is there are other options besides statins pharmaceutically. There are things like bempedoic acid and ezetimibe. Those two in combination have been shown to be as effective as statins at lowering cholesterol levels. And then we have the PCSK9 inhibitors. Now, these are much more powerful cholesterol-lowering medications. Thus far, I'll say we haven't yet seen some of those effects that we see with long-term statin use, but we've also have much less experience with PCSK9 inhibitors, so I'm cautious about that. But I do talk to people that if you decided that, you want to lower your cholesterol, there might be better ways to do it than the statins these days.
What would happen if somebody started to eat eggs for breakfast every day for the next 30 days? They say, I'm going to have 4 eggs for breakfast. It's going to be my next 30 days, just eggs for breakfast cooked in butter. What would happen to that person?
In general, I think they'd probably get healthier because the effect of having a nice high protein, high fat breakfast like that is you're going to have less desire to eat carbohydrates and probably less desire to eat in general throughout the rest of the day. And I think it would be a great way for anyone to start their day.
I agree. You're going to lower insulin, feel good, have good energy levels.
I have a brand new book called Metabolic Freedom, published with Hay House, being released May 13th, 2025. This book outlines the exact steps to restore your metabolism, heal your hormones, and burn fat. It presents to you the problems to why we see metabolic disease and the exact steps to restore your metabolism to burn serious fat. At the end of the book, there's a 30-day plan for you to lose up to 30 pounds in 30 days. And here's the exciting announcement. You could get this book right now. And when you order it today, you'll get a free Metabolic Freedom mini course where I teach you how the metabolism works, my favorite keto and fasting hacks to burn fat, and exclusive interviews with Dr. Jason Fung, Dr. Daniel Pompa, Cynthia Thurlow, Megan Ramos, and others. That is all for free in this mini course. If you go to the QR code on the screen right now, or if you're listening on the podcast, head to metabolicfreedombook.com or click the link at the top of the notes of this video and this podcast. You could go purchase the book right now and get immediate access to this free mini course and exclusive interviews. Click the link down below or go to metabolicfreedombook.com.
If I gave you 3 scenarios and we think about which of these scenarios contribute to heart disease faster, which scenario would contribute to heart disease faster? Smoking cigarettes every day, number 1. Eating processed sugar every single day, or eating processed vegetable oils every day? Which one will contribute to heart disease faster?
Yeah, this is a great question. As we're recording this, I actually have a poll currently up on my Twitter.
Do you?
That's kind of along the same lines, right? It talks about 2 fast food restaurants, one that says they don't use seed oils and one that says they only use 100% grass-fed beef. Like, which one are you going to? The seed oil question is an interesting one. And I think, seed oils mechanistically, right? We have kind of a direct line between how seed oils can damage the mitochondria and can lead to insulin resistance. Sugar, in and of itself, right, doesn't necessarily have those same effects. Over the long term, the high sugar driving the high insulin can ultimately lead to that insulin resistance and problems. But there's actually, in my mind, a much cleaner line between the seed oils and the sugar. The seed oils and the insulin resistance than the sugar.
Interesting.
Now, the reality of the situation, right, is you really can't eliminate or lower one without the other, right?
Yeah, they're
they
usually
are so
packaged together,
tightly packaged within our food supply that it really becomes difficult, one versus the other. Now, comparing it to smoking, I do believe that the let's say food-driven insulin resistance is a bigger risk factor than smoking when it comes to heart disease. I guess if I really had to choose, right, I would almost rather have someone who smoked, but they were doing, let's say, a carnivore low-carb diet than the opposite.
Interesting.
It's, now I know very few carnivores who continue to smoke, but honestly, there may be some relationship, right? If the damage from smoking is probably magnified by insulin resistance.
Yeah.
And, smoking in and of itself may not be as harmful without that insulin resistance. Not something I've seen tested in the literature, and would be pretty hard to do because, like I said, it's going to be pretty hard to convince someone who is paying attention to their health to the point that they're, managing insulin resistance, and convince them to, keep smoking.
Right. Well, the thing about smoking, what makes it so bad for you as it relates to heart disease? I know there's benefits to nicotine. It's a nootropic.
Yeah.
Creates neurogenesis, mitochondrial uncoupler. But is it the actual tobacco smoke that's making it dangerous?
Yeah, I think it's all the other stuff that's in
the chemicals.
Cigarettes,
Yeah.
right? I don't think it's the nicotine itself. It's all those chemicals that are in the cigarettes that are causing the problems. And even in, chewing tobacco, right, is still not a clean, pure nicotine product. These nicotine, we do now have kind of the nicotine supplements. And I haven't seen the data to suggest that those are harmful in the same way. It really seems to be the other toxins that you're getting when you're smoking cigarettes or even chewing tobacco that is causing the damage to the blood vessels that's driving the heart disease.
Yeah, that makes sense to me. You were recently in D.C. for the inauguration and the MAHA movement with RFK Jr. How was that?
Yeah, it was very exciting to see this energy around health, this focus, health being a focus within the new administration, RFK leading it. Now, unfortunately, as we're recording this, right, RFK hasn't made it through his confirmation yet, so that's the first step. A lot of the other, maybe not as publicized health-related appointees, I think also have a similar focus. People like Marty McCary, who's going to be leading the FDA. We have Jay Bhattacharya is going to be leading NIH. So I'm optimistic about the whole focus on chronic disease within the administration. I mean, it made it into Trump's inauguration speech, right? One of the things he said was, we're going to end the chronic disease epidemic.
Amazing.
Yeah,
it
really was.
You used to see a politician say that, and it remains to be seen if that's going to happen, right? But we know something's got to change. Whether you are left, right, or in the middle, it's like something's got to change. We have a big problem here in the U.S. There's a lot of excitement, but what are some practical things? Like, how do we start to find these practitioners? How do you become a practitioner? Like, what are some things we could do right now?
Yeah, that's really one of the key things that I think we need to focus on within this whole movement, right? Because more and more people are hearing about it. More and more people, see all the great content you put out on YouTube and, all this content that's out there. And they're understanding the sort of false narrative, that was the food guidelines, we'll call it, right? The whole low-fat, focused thing. I think people are waking up to the fact that that's not working. Mm-hmm. People are waking up to the fact that processed food is not good for you. But then the challenge becomes, how do I find a doctor that's aligned? Because so many of them go to their doctors and they still get the false narrative. Yeah. They get told that if you eat, real food, it's going to raise your cholesterol and cause heart problems and, cause all these other issues. The false narratives around, red meat, for example, being associated with cancer. That hasn't yet been dispelled enough in the medical community, unfortunately, even though it's pretty obvious that it's not true. So finding the practitioners that are going to help people to implement this is the next big challenge. And again, this upcoming weekend, I'm going to be speaking at 𝙎𝙬𝙍𝙬𝙀, one of the conferences, and that's what my talk is about, to the practitioners, how you implement it, how I went from, just being a heart surgeon to building a successful telemedicine practice, work with people all over the country now to keep them off my operating table, to prevent the heart disease. And actually, it's not only about that. I work with people who have had surgery, have had stents placed. They have the advanced heart disease, and we're managing them with diet and lifestyle, low carbohydrate focused approach, reversing their insulin resistance, and we can stop the progression of the heart disease. In some cases, we can even start to see reversal of the heart disease when we do that. And in the meantime, we're getting them off medications. We're, reversing their diabetes. Their blood pressure's coming down. We get them off the blood pressure medications, and we see great effects. There are lots and lots of practitioners who understand this, and they want to do it. They just don't know how. Mm-hmm. They don't know how to get out of the system and start to do this with patients. So that's one of the things I'm excited to talk about, and hopefully empower the physicians and the practitioners of all sorts to better help people to do this. People want to be healthy. They just need the guidance to be able to do it.
Yeah, and there's a lot less red tape around those who want to make that transition, a lot less censorship that we had the last 4 years or so. I definitely felt a lot of that censorship on my social media. A lot of videos had false information tags, and I got shadow banned and things taken off of YouTube. That's looking like it's changing and going into a right direction where people actually could share their truth. You're a great resource to help people make that transition, right? Your website is ifixhearts.com. That's also your social media. You were mentioning the food pyramid and like the old nutrition guidelines that we know is incorrect. Did you see that clip of the recent South Park episode? Do you know what I'm talking about?
The one where they flip the pyramid upside down.
And I wish we could show it on YouTube, but we might get like flagged, so we won't. For copyright, but essentially it's they were talking about this obesity crisis, like, oh my God, we have a big obesity problem in the United States, which we do. Here's the food pyramid, what can we do? And they're like, turn it upside down, and they flipped the pyramid where the grains went to the bottom, or the opposite direction, where it was meat and beef and eggs and dairy at the top, like at the base. I mean, the bottom being the number one thing to consume. So essentially, you flipped it: less carbs, more fat and protein. And they're like, we solved the obesity crisis in America, and that is exactly it.
That is.
You do the opposite, don't you?
Yeah, and it's amazing how it's almost a parody, right, on South Park, and yet it is the truth. And that's, that really becomes the challenge, right? It is so hard to convince people that we got it so wrong.
Yeah.
Right? It's not that the food pyramid is a little bit wrong. It literally needs to be flipped upside down. And honestly, I hope it's one of the things that comes out of this administration.
Me too.
I was lucky enough to be sitting with Nina Teicholz at the Maha Ball. And she has been doing such amazing work now for
long time,
yeah, 10, 15 years that she's been trying to expose all the problems with the food guidelines, the conflicts of interest of the committee members, the unwillingness of the committee to really look at the science behind diets and incorporate them into the food guidelines. And one of the best things I think that could happen early on in this administration is if they come out and say, we're not releasing the planned 2025 update to the food guidelines. We are calling for a complete, restart of this process and bringing in people like Nina who could, make that a more balanced approach, really make it based on the science, right? And that term has been so hijacked over the last few years.
Yeah.
But let's really go to the science and let's see what is going to make people healthier. Because, again, we've been dealing essentially with the same version of the food guidelines now for 40 plus years.
It doesn't work.
It does not work.
We've seen
it is a failed experiment.
Disease, obesity. I mean, by 2030, Harvard is saying 50% of the population is going to be obese. We see cancer on the rise, heart disease on the rise. Yeah, something's got to change. That would be amazing if they did that. Hey, we need to halt this. We need to revisit this. Bring Nina Teicholz in. Amazing. She's done such incredible work.
Minerals, minerals, minerals. You hear a lot of people out there speaking about the benefits of taking minerals. And it is important because in this day and age, our crops, our fruits, and our vegetables, they are depleted of minerals. So you've heard of the keto flu. You've heard of symptoms doing keto and fasting. People just don't feel good sometimes. This is the number one reason why. So my go-to for replenishing my electrolytes and my minerals, for enhancing my immune system, for gut support, for detoxification, is Bean Minerals. It has fulvic and humic compounds, and these have over 70 trace minerals and really important electrolytes to replenish your body with. Check out Beam Minerals over at beamminerals.com. Use the coupon code Azadi, my last name, at checkout to get a nice discount. That is AZADI at checkout over at beamminerals.com.
It's just so cool to see people like Nina and you and people in the space that have been teaching this for such a long time finally get the respect and the spotlight that they deserve. And now the mainstream is now open to it. Now, it's unfortunate that the second you said Maha, some people listening and watching got turned off.
Yep.
It's unfortunate. And they're probably not even listening anymore. They probably said, oh, screw this guy. He's a Trumpster, right? It's not about Trump. It's not about left or right. It's about our health. And what has been happening doesn't work. The system doesn't work. We need an overhaul. And if it's Maha, even if you're far left, and if it's Maha that's going to get you there, then hey, that's amazing. I posted something about Maha the other day, and somebody commented on my Facebook saying, oh my gosh, I've been following you for 8 years, and Maha, like, you're bringing up this stupid movement. It's like, I'm losing respect for you. I'm like, you don't want America to be healthy? Like, that's what it's about. It's not about me endorsing Trump or anybody. It's about us just being healthy. It's just a shame, Doc, that everything is just so polarized these days.
Yeah, no, that's really true. And you know, we got to keep in mind that, you know, Robert F. Kennedy came from the other side of the aisle.
Right.
You're right. This should not be a partisan issue. This should be, everyone can agree, make America healthy. I also, you know, am cautious, right? Because politicians say things and don't always do what they're going to say. True. And my message is, you know, to my audience is, don't wait for the politicians, right? You don't need to wait for the government to flip the food pyramid upside down. You can do that yourself at home. There's no food pyramid police telling you you need to follow it. You know, the food pyramid is problematic because it directs our institutions, our schools, our hospitals. You know, they're sort of beholden to these guidelines. But you as an individual, you decide what goes in your mouth. You decide what you do on a daily basis. And so don't wait for the politicians. Let's make America healthy by each one of us as individuals focusing on our health. And that's the way we're going to get real change.
100% agree with you. Your website is ifixhearts.com. Your podcast is titled Stay Off My Operating Table with Dr. Philip Ovadia. Your book is also titled Stay Off My Operating Table. I got a nice signed copy and a note from Dr. Ovadia the last time I saw him. And then I remember we had a good steak at that Argentinian restaurant. Remember that?
Indeed.
Anywhere else you want him to go before I ask the last question here?
No, really, iFix Hearts is the place to go. And we have so many ways that we're trying to connect and work with people. We have programs. We have full telemedicine medical care available. Like I said, we're really trying to implement this and help people implement it. So just come check out what we're doing, and hopefully we can help you as well.
Yeah, and he can. Go check him out. We'll put all those links down below. I always ask my guests this final question. I asked it last time. It's about gratitude, vitamin G. What do you have vitamin G for today, Doc?
Yeah, you know, this week I'm really just have such gratitude for the opportunity that has been that I've been given, right, to be in that room, to be talking to not only the health-focused people there, but it was the business people, it was the celebrities, right, and they're all focused on health, and it was just such a positive environment. That's really the biggest thing that I came away from. You know, a couple of days in Washington, D.C., there was such positive energy around health in that room. And I know that change is coming. I know that the people are going to lead that change. And I've just have so much gratitude that I've been given the opportunity to help spread this message, help push it along.
It's a well-deserved opportunity. You've been doing a great job preaching the message. You've got great experience. I've learned so much from you all the time. It's a very exciting time.
If you enjoyed that conversation, check out the recent interview I did with Dr. Berg, all about eating the right foods on keto and carnivore, how to burn fat and feel good.
Sometimes people think that ketones are a secondary source of fuel and the primary is glucose, but if that was the case, where was this glucose available long ago when our bodies were developing? It's so